Hey everyone, today we'll be talking about toothbrushing. My name is Ibukun Lutu Akoni. I am a dental therapist and I work here in Money Dental Care Limited. So, the first question that comes to your mind is when should you change your toothbrush? A lot of people have actually been asking this question. So, today we'll be talking about it. So, first, you need to know that you are to change your toothbrush every 3 months, that is 4 times in a year. For no reason should you keep your toothbrush longer than 3 months. Yes, and this is because most times, as at the third month, the bristle of the brush would have started wearing out, and it won't be able to brush your teeth clean anymore. So we advise that you change your toothbrush at that time. And also, you need to know that when you just finish treating any oral infection or any oral diseases or any oral ailments or even malaria, we advise that you change your toothbrush because we don't want you to have reoccurrence of that oral problem again. So once you come down with cold and you're done with your treatment, change that toothbrush. Is actually advisable you do. Also, it's advisable that you brush your teeth last thing at night and in the morning, that is twice daily, using a fluoride containing paste. This is something you should be doing, and this is because it helps to prevent a whole lot of dental problems. So, if you're this one person that like to have a good oral hygiene practice, then you need to know that changing your toothbrush every 3 months and brushing twice daily, especially last thing at night and in the morning, preferably after breakfast, is such a good thing, a good habit you need to. Also, you need to know that as an adult, you are meant to use a medium bristle brush, and for the kids, let them keep using their soft bristle brush. For no reason should you make use of an hard brush, except you have a denture in your mouth that you're taking care of. Dentures, you're meant to use hard brush to wash your denture, not your teeth. So please, if you've actually been making use of hard toothbrush to brush your teeth, it is time to stop. If you're seeing this video, it is a sign that you need to stop using the hard toothbrush. And also, you need to know that you need to brush correctly. In this video, I'll be showing you how to brush correctly. If you're not brushing correctly, the tendencies of you having gum inflammation, bleeding gum is very high. And that's become because when you brush wrongly, you tend to harm your gum, which might lead to gum bleeding, and at the same time you tend to harm your gum, which can also lead to gum recession. So we don't want you to have any of these. That is why we're actually bringing this to you at this time. I will also be teaching you how to brush correctly. You need to note that for effective brushing, you need to brush for 2 minutes, and then the technique is you place your toothbrush at an angle of 45 degree. If you're brushing the up, you swipe down. If you're brushing the down, you swipe up. You don't have to brush your teeth like as if you're brushing a gin or you're washing a gutter. Your teeth is not as dirty as your pit latrine. So you need to brush gently. Gentle brushing for 2 minutes correctly is the right thing to do.
Part of your daily dental care routine, and when done properly, leads to a healthy mouth and smile. Proper brushing should take at least 2 minutes and be done twice a day. Using a soft bristled brush and a fluoride toothpaste are recommended for removing plaque from your teeth. To follow the correct brushing technique, start by tilting the brush at a 45-degree angle against the gum line. Using short, back and forth strokes, gently brush the outer, inner, and chewing surfaces of the teeth. When cleaning the inside surfaces of your front teeth, make sure to tilt the brush vertically and move your toothbrush in up and down strokes. Finally, make sure to gently brush your tongue to remove bacteria and help freshen your breath. Remember to replace your toothbrush when it begins to show wear, or every 3 to 4 months. You should also change your toothbrush after you have had an illness. Keeping a regular toothbrushing routine and using proper brushing technique is one of the most important things you can do to keep your teeth free of bacteria and reduce the likelihood of tooth decay.